Good afternoon, good morning. We're so excited that you're able to join us today for the This is Public Health Graduate School Mini Fair. My name is Jonathan King, and I'm the Director of Recruitment and Admissions at the Association of Schools and Programs of Public Health. I think you're in for a treat today to hear about some great school and program options. And before we get started, I want to make sure that we take a few minutes to go over some housekeeping. Um, if you would like to take a minute to change the view and the video layout to active speaker view and gallery view and hide non-video participants, this will kind of help your viewing experience. So I want to give everybody a few seconds to kind of get this done and follow these instructions. The format for today is we're going to start out and have brief presentations from each one of the institutions joining us. They're going to each present for about 5 minutes, and the second half of the event, we will open up breakout rooms, and those breakout rooms are a chance for you to meet with the representatives and ask your specific questions. And it's a chance to ask anything that you have about the admissions process, what makes their program unique. It's just a really great chance to connect with the program representative. We will also have the breakout room set up so that you can go in and out of rooms as you choose. So there's no timed participation for each room. So with that being said, the order for today is Northeastern University MPH program, Tufts University School of Medicine Public Health program, University of Alabama, Birmingham School of Public Health, University of California, Berkeley School of Public Health, University of California, Irvine Program of Public Health, Washington University in St. Louis, Brown School of Public Health programs. So as each presenter finishes, they will introduce the next presenter. And with that being said, I'm going to turn things over to Northeastern University, stop sharing, and let them get things started.
Great. Hi, everyone. Can you see my slides okay?
Yes.
Great. Well, thank you, Johnston. Hi, everyone. My name is Emily Gurley-Scott, and I'm the Assistant Director of MPH Initiatives and Accreditation at Northeastern University. I'm joined today by my colleague, Caitlin Barrows, who's the Program Manager and is also a 2020 alum of the program. She'll be with you at the breakout sessions today. Thanks for joining us, and let's get started. So we are a Masters of Public Health program within Bouvet College of Health Sciences at Northeastern University. So here on this slide, you can see our mission, which is that through innovation and experiential education, research, service, this MPH program trains diverse and skilled professionals to promote and protect the health of all communities. We really have a strong emphasis on social justice and social determinants of health throughout our curriculum. And you'll see that both our student body and our faculty represent a really diverse and multifaceted public health learning community. We have four distinct pathways to gaining your MPH at Northeastern University. We have our traditional MPH, which is based in our Boston campus and also fully online in an asynchronous format. This is the most flexible option in our degree pathways, where you can study full or part-time. You could application to apply for this is both in the fall and spring cycle. And your course map is flexible in the sense of that we really want to work with our student body and what makes sense for you to study your MPH based off of your other personal and professional and academic commitments. So our classes in the Boston campus are all in the evening. They all start at 5 p.m. or later. And the online classes are fully asynchronous. So we see a lot of students in this traditional pathway taking a mixture of both online and on-ground campus classes to best meet their schedule. The next pathway is our one-year accelerated MPH, and this is launching for fall 2023, which is a one-year full-time, fully asynchronous program where you are in a cohort model where you are in classes for 12 months, completing our full 42 credits of our accredited MPH program. The emphasis here is also on industry partnerships and for the availability for you to work with your cohort on different experiential projects, both throughout the coursework and then, of course, in our experiential coursework. And next is our MPH in Charlotte. One of the strengths of Northeastern is really our global campus network of both faculty, scholars, students, alums, and one of these is at the Center for Health Sciences in Charlotte, North Carolina. And so here we have, again, a fuller part-time program, but the emphasis here in Charlotte is the majority of the classes are online with residency courses embedded in local public health in the region. So students would be coming to the Charlotte campus to study and take specific coursework with faculty and community experts. And again, with that real emphasis on local public health and reinvigorating the local public health workforce. On this slide, you can see the outline of our 42 credits of our MPH curriculum. You can see the public health core and also previously known as our urban health core, we are rebranding as the social determinants of health core. And this really helps us reach folks who are not just working and studying in an urban setting, but really addressing the needs of public health professionals to be able to solve complex health problems and complex health environments. You also have the opportunity to take 3 elective courses and our practicum and our capstone here. Practicum is the 200-hour community-based practice experience. And then our capstone students at Northeastern have 2 distinct options. One is to complete a traditional capstone project. And the second is to complete the certified in public health exam and write a literature review on the topic of your choice. We're seeing that a lot of folks are interested in this standard credential, the CPH exam, and we are excited to be able to offer this opportunity embedded in the capstone course. Just to emphasize, we are a program of public health with this one concentration. However, you can use your elective courses to really think about areas of interest that speak to your desires in public health. And that could be things like public health technologies, public mental health, maybe you're interested in health policy, and there's really a whole suite of coursework across the university that you can take for these 3 elective classes. Here on this slide are an example of some of those sample courses that could be elective opportunities depending on what your areas of interest are, whether research, policy, programming. We are seeing a lot of folks interested in health technologies and public mental health as well. So our student body is comprised of both full-time and part-time students, on-campus and online students, and also a variety of students in our dual degree program. So in addition to those 4 traditional standalone MPH pathways I mentioned earlier, we also have a variety of dual degrees, which are listed on this screen here. We'd be happy to talk more about those as well, but partnering with our colleagues from the Physician Assistance Program, from the Health Informatics Master's Program, from the JD MPH program, really help to strengthen the classroom environment from you learning from your peers as well as from your faculty. So before I hand it over, just wanted to get some quick deadlines up here for you all. So we are still accepting applications for fall 2023. That deadline is June 30th. And for that traditional, either Boston-based or online program, we do have a January start, and that deadline will be November 15th once that next application cycle opens in mid-August in SOFIS. I'm happy to put my contact information in the chat, and I really appreciate kicking off today's mini fair, and I will hand it over to my colleague Francisca from Tufts.
Can everyone see my screen okay now?
Yes, we can.
All right, so I'll get started. My name is Francesca. I'm the program manager for the Tufts MPH program. If you're not familiar with Tufts, we have 10 campuses located inside and outside of Boston. The MPH program specifically is located on the Boston Health Sciences campus, and that's located right in the heart of Boston in Chinatown. We are housed in the medical school. Our program actually started in 1996. Even though it's a standalone MPH program, we are very much part of the medical school. The program is a CEIF accredited program. And as you can see, our mission statement is very career oriented. We are a practice-based program designed to help you successfully start or enhance your public health career. We have about 300 students in our program, which comes down to a 6-to-1 student-faculty ratio. The maximum number of students per class is about 29. We do have, that's the maximum, but we do have anywhere from 13 up to 29 students per class. This really allows students to get to know their faculty, and it allows for open discussion and personalized learning experience. Our program can be done with 42 credits. We have 4 main concentrations, but in addition to these concentrations, we also have some dual degrees in PA, MBS, JD, MBA, and a few others to pick from. And because we're also part of the medical school, we do have an MD and PH program as well. We have 7 core courses that all MPH students have to take regardless of their concentration. And in the end, all students have to submit an applied practice experience and an integrative learning experience, which I will talk to you a little bit more later. These are the 7 core courses that all MPH students have to take. As you can see, the courses touches on a lot of different areas of interest that you are able to take. The 4 concentrations that we have is the population health promotion concentration, the epidemiology and biostatistics, and then the health services management and policy concentration, and then nutrition. These are the 4, like I said, these are the 4 main ones, but there are also dual degree programs as well. And in the breakout rooms, I can tell you more about what these concentrations entail. Every accredited MPH program has a practice and integrative experience component. Engaged scholarship skills and planning program is where you actually get to do these 2 components. ESP will provide the framework and support needed to complete these 2 essential components. CEIF requires this of all accredited institutions. So when a student starts in our program, they are enrolled in ESP. ESP happens over 3 semesters, and it's done through a series of workshops and mentorship led by a course director that will help you identify and provide you the resources that you need to get your applied practice experience and an integrative learning experience done. This all comes down to 160 hours minimum for field work in our applied practice experience. And in the end, all students must submit a cumulative ILE product upon completion of ESP. And just before I end, I just want to quickly touch on some deadlines. We take our applications through SOPAS, and we try our best to get decisions out within 2 to 4 weeks of application. We are currently open and still accepting students for our fall program. That deadline is extended until June 15th. And then soon after that, our spring application will open, and that deadline will be until October 15th. Most of our students are in the full-time program, but there are some that are in the part-time program. We do have an on-campus and residential component of our program. Most students will complete the program in about 2 years. We also have our accelerated program where students can complete the program in 1 year or less than 2 years. And then there's a part-time program. This is just really a self-paced program, so students can take maybe a course or 2 per semester, or they can have a full load of credits per semester. It's just really up to you. but we just require that all students complete the program within 5 years. So if you have any questions, I will be in the breakout rooms to answer those. I'm going to turn this over to the University of Alabama in Birmingham.
Hello, everyone. My name is Kashanti Farmer, and I am the Program Manager for Population Health and Coordinated Degree Programs here at the University of Alabama at Birmingham School of Public Health. So give me just a quick second, and I will share my screen with you. Okay, so just a quick welcome to the School of Public Health here at UAB. We are a public institution located in the heart of Birmingham, Alabama, with about a 1.2 million person population. We are one of the largest academic medical centers in the United States and the single largest employer with over 26,000 employees across the state of Alabama. We were voted America's Best Large Employer by Forbes of 2021, and we were named for 4 straight years as Diversity Champion by Insight into Diversity Magazine for our diverse student and employee population. And we are amongst the top 10% of universities globally for research and reputation per the US News. The UAB School of Public Health is the only SEAF accredited school of public health in the state of Alabama. We are now ranked number 17 nationally by US News and World Support, and we are ranked number 19 in NIH research funding as of 2021. I believe our ranking for 2023 has yet to come out just yet. We have received over $37 million in research funding, and all of our public health concentrations can be completed completely online. So I will go through this very quickly because I know that, in the interest of time, I do have other colleagues who are wanting to present on their various institutions. We have over 13 different programs across our five departments. We have biostatistics, epidemiology, global health studies, environmental health sciences, health behavior, as well as health policy and organization. And if you all have any specific questions about any of our specific programs, whether they are MPH, MSPH, or DRPH, I will be more than happy to answer them in our individual breakout session. And I will now be transferring it over to the colleague that is after me. I forgot which university was after mine. I apologize.
Yeah, no problem. We're looking forward to having the University of California Berkeley School of Public Health present now.
No worries. All right. Hi, everyone. Thank you so much for being here, especially so early on into the graduate application process. My name is Ella Crawford. I am the Residential Admissions and Recruitment Manager for UC Berkeley School of Public Health. I'm going to start off today by talking about why you should consider applying to Berkeley Public Health. So first off, we have a much deserved reputation for student activism. And for us, this really means that our students are drawn to our school because they are change makers, innovators, arc benders, and see this as a place that they can really lead. We have our Diversity, Respect, Equity, Action, and Multiculturalism Office, or DREAM for short. And their mission is to diversify the field of public health. And they do this by supporting underrepresented students during the graduate application process, as well as through graduate school to ensure that they're getting the support that they need, whether that be through additional tutoring resources or working with you as a prospective student to make sure your questions are getting answered. We're not tied to a medical school, and we really see this as a benefit as our students can explore the sort of organic and interdisciplinary nature of the field of public health and really get into the breadth and depth of the work that they do. You can definitely expect hands-on experience in the classroom. Our degrees do include a capstone, so a larger research project in which you can connect with people locally. We also have a practicum component as a part of our 2-year MPH. So in between your first and second year, you can explore a practice in the field of public health. We are a public school, so very connected to the Bay Area and sort of larger California community, not just in terms of research, but also community-based interventions. We provide career services when it is time to find that practicum experience, but also when you're ready to graduate. And as an alum, you can still come back to our school and use those career services. And then finally, while we are not tied to medical school because we don't have a medical school, we do offer the joint medical program with UCSF School of Medicine, as well as several interdisciplinary partnerships and concurrent degree programs with other graduate schools at UC Berkeley. So here's a sort of bird's eye view of our school by the numbers. We offer 46 different graduate programs for you to choose from, and you can see our acceptance rate is a little higher for our professional degrees. So that's going to be the MPH or the DRPH, and a little lower for our academic degrees, so the MS, MA, and PhDs. We have about 740 graduate students in all. About 250 of those are part of the online MPH, and then the rest are going to be with you on campus. And then you can see our full community makeup down there below. When you apply into our degrees, you do have to choose a specific concentration. So we don't have a general degree that you choose or can apply into, but you do have to be very intentional about what you want to study when you're with us. And then here is that total list of 46 different graduate programs. I know this is a lot to look at. And if you're struggling to figure out which is the best degree or concentration for you, you want to consider your background, what skills you're hoping to gain, and what your eventual career goals are. Our most popular is certainly going to be the 2-year Master of Public Health or MPH, and that has the most concentrations available for it. But we also have a 1-year accelerated MPH for students who already have an advanced graduate degree, a number of PhDs, a DRPH, MA and MS, and then some of those concurrent MPH degrees I mentioned earlier. So what does it look like to fund your education? So around 41% of incoming students for fall 2022 were awarded some form of funding as a part of their package with us. The average funding award was around $19,481, but the range was, quite high. So anywhere from $4,000 to $50,000 in those offers. But those are not the only places that you can receive funding in terms of like direct fellowships through the school. We also encourage students to apply for FAFSA, look at training grants through the specific concentrations, consider applying for a graduate student instructor or researcher or assistant role, and then of course also look at your external funding options. So if you have more questions and want to talk further with us, I did notice a lot of people putting their emails into the chat. I really encourage you to scan that QR code so that you can connect with Berkeley and hear updates on different events and information sessions that we're hosting. If you have specific emails, you can contact us at sphadmit@berkeley.edu. That's that very top one. And if you choose to join us during the breakout session, you can expect that we're going to go over the mission and vision, student resources, internship locations for that practicum experience, graduate outcomes, tuition fees, the typical admissions timeline, and how to submit a strong application. Thank you again for being here, and I will pass it over to my colleagues at UC Irvine.
Hello, thank you so much. Let me get my screen shared here. All right. So good morning to everybody from Southern California. My name is Jennifer Crum, and I'm our Senior Graduate Advisor here in the Program in Public Health at the University of California, Irvine. And I'm joined today by my colleague, Gabriella Pham, our Assistant Director of Graduate Affairs, and you'll hear more from her if you join us in our breakout session. So we're just going to spend a few minutes here giving you a little bit of an overview, both of the Program in Public Health and UCI in general. I just want to give you kind of a picture of what our campus is all about and why some of our differentiating factors for UCI Public Health. Here at UCI, we are a Hispanic serving institution as well as an Anapese serving institution. And we're actually rated number 3 in the nation for diversity. And so we really take that seriously. It's something we're very intentional about in our admissions. We do really view diversity as a strength. And so we are trying to bring in a very diverse cohort every time we are admitting students into our program. We also believe here in public health that place matters, and where you do your public health education can have a big impact on your experience. We are located in the heart of Orange County, which is the 6th largest county in the United States. We are a majority minority county, and so there's immense diversity throughout our county as well. And so that gives our students an opportunity to really dive into public health in a number of different areas and really work with a very vast variety of populations. We are one of the largest, if not the largest, undergraduate program in public health in the country. And so with that comes a lot of great resources that our smaller graduate program gets to take advantage of. So we do have about 200 graduate students total. But because of our undergrad program, we end up having about 175 faculty and staff who are supporting students through all of our programs. And so you are part of a large public institution here at UCI, but you do get a lot of that smaller school feel within the program in public health, and a lot of support and resources offered to our graduate students there. In general, we typically have about 25% of our applicants are international students. So we do have a draw across the whole globe. And then about 50% of our applicants are first-generation graduate students. My colleague Gabriella and myself are both first-gen students, and we do really try to put in a lot of support systems to help students navigate what can often be complex graduate education. We offer a number of different degree programs here at Public Health at UCI. You can see we have a Master of Public Health with 4 different emphases options, 2 Master of Science degrees, and 3 different PhD degrees. So you can see all those listed here. All of our programs do require an application through SOFIS, as well as an application through our UCI graduate division. And so you do have to do those 2 applications to be fully considered for admission. All of our application deadlines will vary by program, so you'll definitely want to check our website to see specifically the program that you're interested in, but they do start beginning December 1st. We only admit into the fall quarters here at UCI, and so our applications for fall 24 will open in October, and again, deadlines will begin in December. So we are already closed for admission for this fall 23. The GRE is not required for any of our programs except for a PhD in public health. It's a really exciting time here at UCI Public Health, so we do like to share a little bit about what's going on here. We are one of the younger public health programs in the country. We've been around for about 12, 13 years now, and we are currently in the process of transitioning from a program in public health to a school of population and public health. And so what does that mean for you as a student? One of the big things is it means additional funding for both our students and our program. Right now, 100% of our graduate students receive at least partial funding. Our PhD students do receive full funding. And just within this past quarter, actually, we were able to launch 4 brand new scholarship programs that are donor funded, and we anticipate just being able to add more and more as we go. We have more academic program offerings and research opportunities with this additional funding as well. We just received a $14 million gift, which has allowed us to bring in 7 new faculty endowed chairs in different areas. So our students really get to learn from a diverse set of faculty as well. It's also allowing us to expand our academic offerings. We do have 3 new concentrations planned for our MPH program, and those will be coming on board in another couple of years. So an exciting time here. We are part of the College of Health Sciences, along with nursing, pharmacy, medicine, and integrative health. You can see this beautiful building behind me as well as on the slide. This is our brand new building of College of Health Sciences that just opened in January. And for the first time now, the College of Health Sciences now all under one roof. And it's really given our students the opportunity to engage in a lot of interprofessional learning experiences. A number of our students are studying in labs with our School of Medicine faculty and really looking at those connections between public health and medicine. Our pharmacy students are actually taking public health classes and seeing some of the integration there as well. And so that's a really unique experience for our students. Here at UCI, we really are a hub of innovation of public health teaching, practice, and research. And because of that, here in Orange County, we do have partnerships with over 100 community organizations. And so our students really have a wide network to choose from when they are looking for practicum options and career options. So again, that's just a little bit about UCI. I do hope that you will join us in our breakout session. We'll talk a lot more in detail about our program offerings and application process. So again, you can scan the QR code here to be taken directly to our website for more information. And we hope you'll find your future here at UCI. As I stop sharing my screen, I will pass this over to my colleague over at Washington University Brown School of Public Health.
Hi, everyone. My name is Makia El-Ghamdi. I use she, her pronouns, and I am the admissions and recruitment specialist for the Brown School at Washington University in St. Louis. So today I just wanted to share real quickly our value statement, which is dedicated to equity and committed to impact. And this is the type of work that we have been doing, and I hope that you will join us in that work. So let's have a look at the numbers here at the Brown School. So we have 3 graduate programs. We have the MPH program, MSW program, and MSP program under one roof. We have a 9-to-1 student to faculty ratio. We have over 20 affiliated research centers and 3 community-based research initiatives. We also have about 400 plus field education practicum sites to choose from. And then 100% of our students who request scholarship will receive an award from the Brown School. And so one thing that's unique about the Brown School is our curriculum is designed to be different. So our transdisciplinary problem-solving approaches drive comprehensive and sustainable solutions. We're also grounded in driving health equity and, by extension, social, racial, economic equity as well. Our curriculum is also focused in research and evidence-based practices. So not only theorizing, but we also apply research in the classroom. We have about 180 paid research positions last year, and that continues to grow every year. We also have skill labs that are focused on in-demand, hands-on applicable skills that you can use and put on your resume, such as GIS, R, contact tracing, grant writing, project management, public speaking skills, etc. And so let's have a look at our program details. So our program is 2 years with 52 credit hours, and we have about 6 STEM designated specializations to choose from. And then we also have 2 certificates to add onto your program if you choose to do so. And so how the program is broken down, you have your first year and your second year. Your first year is mostly going to be your foundation courses. So you're going to focus on your foundation level coursework. You're also going to have research method courses, and then you'll also have the planning, implementing, evaluating evidence-based programs and interventions. And then during the summertime is where you'll dedicate your time towards your practicum, which is about 360 hours. And then your second year will be mostly your specialized coursework. So you'll take all your specialization requirements that are related to your specialization. You're also going to have transdisciplinary problem-solving coursework. We call them TPS on our website. And then you'll also have time to take electives. So your electives can be additional public health coursework. You can also take electives from the social work program, the social policy program, or you can also dedicate your electives towards your certificate. So in addition to our program, we also have the option to do dual degree programs or joint degree programs. So as a public health student, you can add on a dual degree from the social work program or the social policy program within the Brown School. You also have the option to apply to other schools at WashU. So for example, if you would like, you can do a joint degree in public health and anthropology, or architecture, business administration, law, medicine, and occupational therapy. And when it comes to the joint degree programs, you will have to apply separately to each school and be accepted to each school in order to do the joint degree program. And of course, if you have questions about this, you can reach out to me later on. And so let's have a look at the application details. So for the MPH application, we require a few things. We do have a personal statement requirement. We have prompts on our website to guide you through the personal statement. We also have 3 letters of recommendations. It can be your professors, supervisors, anyone professional. We also require a comprehensive CV or a resume. We also require the official transcripts to be sent in and verified through SOPAS. And then we also have an online interview. And then we have a human biology prerequisite, and then a SOPAS application for you, of course. And if you don't have the human biology prerequisite when you are applying, you can fulfill that once you are admitted. You can fulfill it by the end of your first year. And so when having a look at the application deadlines, you'll probably see that you missed most of them, but we are currently enrolling admissions. So rolling admissions will continue to accept applications up until July 1st of this year. So if you're interested in enrolling for fall 2023, I would suggest applying as soon as you can, and you have time up until July 1st. July 1st is when we'll close our application portals. And if you have any questions about application requirements, you can email us at brownadmissions@wustl.edu. In addition to these requirements, we do have one additional international requirement. So for international students, you are required to provide proof of language proficiency. So of course, you'll submit your TOEFL, IELTS, or even Duolingo. And we have more information on our website for the requirements. And you can also, of course, ask me questions about that later. And then for our PhD application details, so similar to the MPH application details, we have a SOFAS application fee, official transcripts to be submitted through SOFAS, a curriculum vitae, a CV, and then 3 letters of recommendations, and then a statement of purpose and objectives. And then you also have an additional writing sample. One thing different from the when you compare it from the PhD program and MPH program is the PhD program has one set deadline, and that's December 1st. So that's passed for the fall 2023 cycle. But if you're interested in fall 2024, definitely recommend starting the application sometime in October and November so you can meet the deadline of December 1st. And if you have any specific questions about the PhD application itself, I would suggest reaching out to brown-phdphs@wustl.edu. I would screenshot this, and I can also share this later on in the breakout room. And if you have any additional questions, concerns, you can directly reach out to me at makia.a@wustl.edu. You can also reach out to our office about any other information at brownadmissions@wustl.edu. And if you have any questions, you can reach out to the PhD Public Health Sciences office as well. And I just wanted to say thank you very much.
Great. I'd like to thank all of our presenters for joining us today and sharing with us what makes their programs unique and a little bit about the application process. I really think one of the best parts about today's event is being able to go to the breakout rooms. But before we go to the breakout rooms, I did want to remind you all that the next ASPPH recruitment programming is going to be the virtual graduate school fair in July. So we hope that you all can attend those, as well as any other recruitment events are going to be listed on our ASPPH event page.